Anxiety and depression are common illnesses within our community currently. It's not surprising that they might coexist with patients who have seizure disorders. It's important to recognise that a patient who has a seizure disorder who also suffers from anxiety or depression develops an increased risk of seizures. As a result, I take the time when I'm assessing my patients with epilepsy, particularly those who do not appear to be travelling well, to inquire about their mood. They're often surprised to hear that there is an interrelationship between being depressed and having an increased risk of seizures. Often patients are reluctant to talk about their mood, but this is an important area to explore and to recognise. Although it's often been suspected or reported at an anecdotal level, we now have substantial scientific data to tell us of the association. And this has come from a rather curious area in the treatment of depression itself. In the recent years, for a medication to be approved for use, it has to undergo a careful clinical study. And that often means that a patient will enrol in a study for a trial treatment, whether it's an epilepsy drug or a depression drug, and run the risk of being allotted a placebo tablet. This is deliberately to assess whether the active drug does do what it's claimed to do, and also to establish what adverse effects might be associated with it. As a result, there's accumulated a large amount of data in patients who are entered in trials of the newer antidepressants. These are drugs that clearly are of moderate efficacy in stopping depression. When all this data is accumulated, it became apparent that when patients who were depressed and had no other recognised illnesses were allotted to the placebo tablet, they had twice the risk of having a seizure during that period compared to the general population. The patients who were allotted treatment with the antidepressant drugs had a risk that was only marginally elevated compared to the general population. It's not clear whether the antidepressant drug, by alleviating depression, is lowering the seizure threshold, or whether the antidepressant drug may in fact have an anti-seizure effect itself. But it's such an important risk that if your doctor inquires about it, it's most helpful to be a little bit open and frank and acknowledge these problems if they are present, as early treatment will make a difference to the ongoing health of the patient.